And welcome back to Fox 8 News in the morning. Just when we thought we had tamed the coronavirus, infections have spiked in nearly every state in the nation. Good friend Dr. Amy Edwards of University Hospitals joining us now with an update on the local impact and reaction from the governor's message to Ohioans last night. Dr. Edwards, always good to see you. Let's just jump right into it, Doctor. First of all, it appears that we are going in the wrong direction. So the question is why?
The answer is very easy. If you go back several weeks, people started to get comfortable. They stopped wearing their masks. They started going out more, having birthday parties and bachelorette parties, and I don't even know what all. I mean, people were going to Put-in-Bay and all sorts of places. And while all those activities are fun, they put people together and you spread the virus, especially if you're not wearing your mask.
When we opened up the economy, didn't we expect something like this to happen?
Yes, we did expect an increase in cases. What I didn't expect, or what I hoped wouldn't happen, is the rapidity with which people suddenly became completely comfortable with things and returned to really normal life. I mean, people were no longer giving you space at the grocery store. People were no longer trying to, limit birthday parties and that sort of stuff. And so it's not just an increase in cases. It's a very disturbing trend towards a real surge. We have to be careful here.
Can we at least feel good about the fact the number of deaths appears to be slowing down a bit?
Maybe. Deaths lag behind cases. So first you get a surge in cases, then you get a surge in hospitalizations, and then you get a surge in deaths. So I think it's a little too early to crow about that yet. Now, there are some good signs. One is that we seem to be better at treating the patients. We've got better medications, we've got better techniques, we understand more what's happening to the body. And so certainly, that's good. But, it's too early to say that we've conquered it.
Dr. Edwards, your reaction to Governor DeWine's address to the state last night?
I agree with him. We're moving in the wrong direction, and it's time for people to man up and act like adults. I appreciated his message that we have personal responsibility here to stop this thing, and we do. I wish he'd gone further. I think it's time for him to mandate masks for the whole state. Just do it. I don't understand why he's dragging his feet on that.
Just talk about the importance of masking up, because people seem to need to hear it more and more. Go ahead and talk about it.
But it's funny, the more people need to hear it, the more data is coming out. There was another series of papers published in the last couple of weeks that really show that in communities where mask wearing is universal or near universal, about 85 to 90%, then coronavirus circulation just drops. It just plummets down to almost zero. So what we know is that if you wear a mask and you have coronavirus, your chances of spreading it to another person are very, very low.
Final question, Dr. Edwards, your reaction. Should kids go to school in the fall? And if they do, what kind of precautions should be in place?
Kids should go to school in the fall if we have control of the circulation of this virus. If everybody is wearing their masks and social distancing and minimizing contact with other people, then it will be safe for kids to go to school in the fall. If we're going up, and 4 weeks from now it's worse than it is now, then no, it won't be safe for kids to go to school in the fall. So we as adults need to spend the next several weeks doing what we need to do to keep our kids safe in school.
Still up in the air. Dr. Amy Edwards, Rainbow Babies and Children's Hospital, our expert. Thank you very much for joining us this morning.
You're welcome. Have a great day.
You as well. Thank you.